AHP is Africa Health Placements. We're a non-profit organisation based in South Africa, and we are working to try and address the critical shortage of human resources that is crippling healthcare delivery in the region. We work off the premise that where there are no healthcare workers, there can be no healthcare delivery, and we essentially exist to try and address that problem and give patients access to doctors, while at the same time giving doctors the opportunity to develop their skills and to work in an environment that changes their perspective on what it means to be working in a healthcare system.
I've been here for 5 years, and during that time I've grown to love the challenges that frustrated me at the beginning. We have at small district hospital level, we have all sorts of infrastructural challenges, but therein lies the attraction of working in an environment like this. The rewards are being part of a system that contributes to helping the most disadvantaged patients in this population and actually making a tangible difference.
Personally, I feel very fulfilled myself as a doctor, going to sleep at night knowing that I've made such a difference in someone's life and in a person that really needs that difference, because it means so much for them to have one thing less to worry about.
Working here in Khabis has been a real challenge, but an extremely rewarding challenge. It's been a fascinating time. I've been here for 4 months now, and what I've really enjoyed is the type of patients that we have. Some of these patients are the most sick patients that I've ever treated in my career so far, and it's very satisfying to actually be able to help some of these patients.
I always knew I was going to leave the UK after foundation years, and South Africa, actually it was just the ease. I heard a lot of other people had done it, had a good experience. I'd heard of AHP, would help you out with it. There was sort of a process to go about doing it rather than just sort of having to find it all yourself. And it was sort of reassuring that other people had done it, had good experiences with it, and recommended it. Also the weather.
And then obviously the lifestyle in South Africa is brilliant, with the accessibility to the outdoors, wildlife, and it's a huge, beautiful country to live in.
The kind of lifestyle that you can have living and working in a rural South African environment is certainly different to being stuck on the London Underground on the way to work. You'll maybe be late for work because there are elephants crossing the gate to the hospital that you're working at.
South Africa is an incredible country. The weather here is fantastic. There's so much to do, whether you want to go to the beach at the weekends, whether you want to go to festivals, you can go hiking in the mountains, or you can just go down to the local game reserve and just see some lions just chilling now by the riverbed.
In an average day, you can be doing up to 10 completely different and unrelated things. So in the morning you can start off with a caesarean section, move on to the drainage of an abscess, then be doing a lumbar puncture, then be seeing a patient and offering supportive counselling, then the list goes on. So every day comes up with surprises and something new to learn.
If you want to do surgery, then that's available to you. If you want to do maternity, and you can actually learn how to do caesarean sections if you'd like, then there is training available to do those things. And you can really pick up a lot of skills by being here.
Since coming here, I think I've sort of picked up different skills. One thing is practical. You do a lot more practical procedures here. I mean, I think in 2 years working in the UK, I'd done maybe 4 lumbar punctures. Here, some days I do 4 lumbar punctures.
So the opportunities for doing practical procedures and improving your clinical skills is fantastic here in South Africa.
Also communication, which is something surprised me, is you sort of learn to communicate with people who really don't speak the language, and working with the nurses as well, and taking their input on lots of different things as well.
I've had to try and learn some Zulu, because very few of the patients will speak any English at all. You never know what each day will bring.
So the opportunity for doctors to work in South Africa, especially coming from the UK, they're vast. We've got a variety of positions, mainly in rural areas where you can gain fantastic work experience, where doctors from the UK can really exercise the reason they became a doctor in the first place. There's a huge humanitarian need here. You've got people who really need your services, and you really get to practice that part of being a doctor.
I think I will undoubtedly go back to the UK as a much better doctor. My clinical skills will have improved immeasurably, and I'll just be able to deal with anything in any given situation. That's one of the things that South Africa has really taught me.
You've sort of got to learn it all yourself and adapt to what is available here, what medical knowledge you have.
I would say for those who are interested in coming to a place like South Africa, then you probably should come. The very fact that you're interested means that you're the right kind of person that will thrive in this kind of environment.
Firstly, I would say do it. I really recommend coming. Really good experiences so far. Firstly, the work-life balance here I think is better than at home.
Go for it. Get started with the application as soon as possible. There's so many reasons to come.
But the main thing is be patient.
The question really is, how are British doctors able to actually get into the country? And that's where Africa Health Placement steps in. We've got working relationships with the Department of Health in South Africa, with the South African Embassy in London, as well as with the Health Professions Council, so that we can support doctors and hold their hand right from the start of the process, through all the bureaucratic hurdles, right to the point where we find them a position that's suitable to their skills, where they've got the kind of support they need in the position that they'll be working in, and get them placed here, orientated, logistically, clinically, culturally, and settled into the work that they're doing here.
I was assisted in coming here through AHP. They helped me get through a lot of the administrative process in making sure that I was a legally practicing medical practitioner and resident of the country that was paying taxes, that kind of thing. So they took a lot of the headache out of organising all of that. And then they've also been of great support guiding me through my career here over the past few years.
You come out with your enthusiasm to serve our underserved hospitals. You add your vibrancy into our hospital. You make a difference. You treat our patients, and we're really grateful for that. But we need more of you. We need more of you to make a difference. We have vacancies in our hospitals. We can match you to a suitable hospital, and we feel that you will gain out of being here. You will gain clinically, you will grow as a person, you will make decisions that you probably won't make back home. You will make valuable, life-changing decisions. And so we ask you to come out, trust us with where you want to be, where you want to go, and we can help you make that decision as well.
In general, it's just been the balance between challenges and rewards on a daily basis that make it into a job that's worth waking up to and going into every morning with enthusiasm.
I'm living my dream. As a little girl, I grew up in a village, studied under the trees, doing my high school under the tree, and I've always thought I want to be a doctor one day when I grow up, and I'm going to come back to the rural communities and deliver the kind of stuff that I needed then that I could be able to get. And now I'm living my dream. So for me, it's just perfect.